All right, so let's say you're about to graduate med school. Years of intense study, you've got all the facts down, all those symptoms memorized. But then you're faced with your first Alzheimer's patient. Where do you even begin to connect with someone navigating that reality, beyond just the textbook stuff? Well, get this. A recent study, straight from BMC Medical Education, explored a pretty unconventional way to bridge that gap, and it involves the film Still Alice.
Using movies to teach empathy to doctors.
Exactly. We're talking about a movie about a linguistics professor grappling with early onset Alzheimer's. Fascinating stuff, right? So today, we're going deep into those findings, going to see if a film can really make a difference in how these future doctors connect with their patients. And of course, to break it all down, we've got our expert here. Welcome.
Glad to be here. You know, the beauty of this study is that it really gets at something so fundamental about learning. It's rooted in this idea from Vygotsky, this psychologist who was all about active learning, getting your hands dirty, so to speak. He always said hands-on learning, especially in a social setting, blows passive learning out of the water.
Instead of just lecturing these med students about empathy, they're showing them a movie.
Exactly. But it goes even deeper than that. The study, which was done at Tehran University of Medical Sciences, didn't just stop at screening Still Alice. They took Vygotsky's lead and layered in reflection and discussion. Both clerks and interns had to really dive into the material and their own reactions, first individually and then through these in-depth group discussions.
Wow. So it's a true deep dive, just like our show. But how do you even begin to measure something like empathy? Isn't that pretty subjective?
That's where qualitative research comes in. The students poured out their thoughts and feelings in these reflection papers. So you're capturing these raw human responses to the film. It wasn't about checking boxes, it was about understanding the why behind their reactions.
Okay, so we've got the setup, but let's get to the good stuff, the results. Did watching Still Alice actually increase empathy in these future doctors?
It really did, and in some amazing ways. The study brought to light 4 major themes, all pointing toward a much deeper understanding of Alzheimer's, and more importantly, a deeper sense of empathy for those living with it.
All right, you've got my attention. Give me the rundown on these empathy-boosting themes.
Well, the first, and this is a big one, is the realization that clear and sensitive communication is key. And not just with the patients themselves, but with their families too. What the students realized is that it's not about medical jargon, it's about acknowledging the emotions, navigating those difficult conversations, and offering genuine support.
It's so easy to forget that a diagnosis like this, it doesn't just impact the individual, it ripples outward, affects everyone around them.
Exactly, and that leads right into the second theme, seeing the whole person. Still Alice helped these students move beyond seeing a disease and allowed them to recognize the individual living with the complexities of it. They began to consider not just the physical symptoms, but the emotional and social impacts, those subtle ways this disease reshapes a person's world.
It's like the saying, treat the patient, not just the disease.
Right.
You're not just treating symptoms. You're caring for a whole person going through something incredibly challenging. What else stood out to these students?
Well, one really interesting outcome was a surge in intellectual curiosity. So many of them talked about this renewed passion for knowledge, this desire to truly understand the science behind Alzheimer's, its treatment, and crucially, how to best support patients and families. Some even felt inspired to go into research in the field.
It wasn't just about tapping into empathy, but igniting a passion for learning, too. That's really something. Okay, now for that last theme.
This one was a bit unexpected, but equally profound. Still Alice led some students to confront their own anxieties about aging, about illness, and about the very real possibility of facing Alzheimer's themselves or with their loved ones.
Wow, that is heavy stuff. It makes you think about how powerful a story can be, not just to build empathy for others, but also to force us to look inward, to face our own vulnerabilities.
Precisely. And it really speaks volumes about what the researchers were after here. It wasn't just about what these students learned about Alzheimer's, but about themselves too. At the end of the day, real growth, it often comes from those moments of self-reflection.
It's amazing, right? To see how a film like Still Alice can bring about such profound shifts in perspective. But, we've been talking a lot about future doctors, but what about the rest of us? Can these insights, these lessons in empathy, extend beyond, the world of medicine?
I think so, absolutely. What we're seeing here is the power of what we call narrative medicine.
Narrative medicine. Okay, that sounds interesting, but what exactly is that?
So it's this really cool field, and it recognizes the power of stories in healthcare. Basically, it's about using things like literature, film, even just patients' own stories, to help doctors and other medical professionals really connect with their patients on a much deeper level.
So it's about going beyond just the textbook.
Right.
It's about understanding what it's actually like to be a patient, to live with a certain condition.
Exactly. And this study really highlights that this isn't just some, feel-good idea. Narrative medicine, it can actually make a difference, like a real difference in how doctors are educated and ultimately how they treat their patients.
It makes sense. I mean, reading about Alzheimer's in a textbook, that's one thing. But experiencing it through a character's eyes, like Alice, that's got to be a completely different thing. You're stepping into someone else's reality.
Precisely.
Mm.
And it's not just about, memorizing the stages of the disease or whatever. It's about understanding the emotional impact, the social ramifications. It's about those struggles, those fears, those moments of grace even that someone with Alzheimer's and their loved ones, they go through.
Yeah, it makes you realize how easy it is to compartmentalize,
Yeah.
especially in a field like medicine. But illness, it's not just a list of symptoms. It impacts literally every part of a person's life.
That's very true. And I think sometimes in the thick of medical training, amidst all the demands, that human element, it can kind of get lost.
Yeah.
And I think that's where narrative medicine can really help. It brings it back into focus.
So let's talk about the real-world implications of all this.
Yeah.
If we can really cultivate a stronger sense of empathy, whether through stories or other means, how does that actually translate into better care for patients?
Okay, so think about it this way. When a patient feels truly heard, truly seen by their doctor, it builds trust.
Right.
And when there's trust, they're much more likely to open up, to talk about what's really going on, to follow their treatment plan, even just to ask questions that they might have been too afraid to ask before.
So we're not just talking about being a nice person, although obviously that's important. It's about tangible outcomes.
Absolutely. We see it in the research, empathy in healthcare. It's linked to higher patient satisfaction, better communication between doctors and patients, and even patients actually following medical advice. And all of that leads to, you guessed it, better health outcomes overall.
Okay, well, so it's not just warm, fuzzy feelings here. We're talking about a real difference in people's lives.
Exactly. And, on the other side of that coin, when empathy is missing, when doctors aren't connecting with their patients as people, well, that can have some really tough consequences. Misdiagnoses, breakdowns in communication, patient dissatisfaction, even medical errors, unfortunately. It can all stem from a lack of empathy.
It's like a good reminder that as important as technical skills are in medicine, that human connection, it really is just as vital.
Couldn't have said it better myself. We need both the knowledge and the empathy to provide truly great care.
We've been talking about Still Alice and how powerful a film can be, but I'm wondering, are there other ways we can exercise those empathy muscles, so to speak? It can't all be movie nights, right?
You're absolutely right. It's not just about passively watching or listening to stories. It's about actively engaging with the world around us, really putting ourselves out there.
Okay, so how do we do that? I mean, how do we take all these insights about empathy and actually apply them in our own lives, even if we're not, training to be doctors?
Well, I think it starts with this understanding that empathy, it's like a muscle. The more you use it, the stronger it gets.
Oh, I like that.
Yeah.
So how do we start pumping that empathy iron?
It's about making a conscious effort to step outside of our own experiences. So seek out different perspectives, talk to people from different backgrounds, listen to their stories, and really try to see the world through their eyes.
It's that real human connection, right? That willingness to bridge the gap between me and you.
Yeah.
And you were talking about stories earlier. Those can play a big role in that too, can't they?
Absolutely. And it doesn't have to be something, super complicated, like a whole movie or a novel or anything. Even just sharing our own stories, like really opening up to people or just truly listening to the people around us, that can really help us build empathy. Think about a time when you really felt heard by someone, like they really got you. It probably involves some kind of genuine back and forth or real exchange of experiences, right?
Yeah, there's that quote. I don't know who said it, but it's like, people might forget what you said or what you did, but they'll never forget how you made them feel. And stories, they make us feel things. They help us connect with each other on a much deeper level.
Exactly. When we let ourselves really be moved by a story, whether it's, made up or from real life, we open ourselves up to seeing things differently, to understanding experiences that might be completely different from our own.
This has been such an awesome conversation. So as we wrap things up here, is there one final takeaway, like a little nugget of wisdom that you want to leave our listeners with?
We often think about empathy as something you're just born with. You either have it or you don't. But I think what this research shows so beautifully, and what Vygotsky really believed, is that empathy is a skill. It's something you can learn and develop.
So it's not about who we are, it's about what we do. We can all cultivate more empathy if we put in the effort.
Exactly. And just like any skill, it takes practice. So, my advice, seek out those opportunities to really flex those empathy muscles. Engage with powerful stories, the ones that really stay with you. Have those real meaningful conversations. And just be open to learning from everyone around you.
What a great reminder. So to our listeners out there, keep those empathy muscles working. You might be surprised by what you learn about yourself and about the world around you. Thanks for joining us for this deep dive.